is Polycystic Ovarian Syndrome Awareness Month, also known as PCOS Awareness Month. It's a hormonal condition that disrupts the reproductive system in women. While PCOS affects roughly 6 to 13% of women, up to 70% of those affected, they remain undiagnosed. We have two very special guests joining us to discuss this more. Ladies, thank you so much for waking up with us. Introduce yourselves.
Hi, I'm Dr. Jennifer Bump. I'm one of the OB-GYN generalists at Texas Children's Pavilion for Women.
And I'm Laura Daddy. I'm the Director of Reproductive Endocrinology and Infertility at Texas Children's Pavilion for Women.
Well, ladies, thank you so much for coming on to discuss this. I've known women affected by this. First, tell us a little bit about what PCOS is.
Sure, so you described it well in your introduction, but basically it's a hormone dysregulation. The way our menstrual cycles normally work is that our brain sends signals to our ovaries that then respond with corresponding hormones. And for reasons that we don't completely understand, somehow that communication gets interrupted between the two.
Oh, so why is it that we're not diagnosed with this?
Sure, so PCOS can be kind of a confusing diagnosis. Unfortunately, in the medical community, we haven't done a great job as far as educating women what it involves, but also it's a diagnosis that tends to be kind of thrown around a little bit too easily. Oh. And so one of the myths about PCOS is that anyone with an irregular cycle or anyone that's having hormonal dysregulation, that it's because of PCOS. Oh. And unfortunately, there's lots of other things that can also cause that. So it's really important as physicians that we take a closer look to figure out exactly what the cause of the problem for each individual woman.
So what are some signs that we may be having this?
So irregular periods are usually the most common sign, but other things that can go along with PCOS is that it can actually affect our insulin regulation. So our metabolism, our how we generate energy and how we store fats. And so someone with PCOS may find that they have a more difficult time losing weight. Additionally, other women may have androgen increases, meaning testosterone, and that can sometimes cause things like excess hair growth or some acne as well.
So should we get a blood test? Is that how this is?
That's one of the ways, yeah. So the things that we normally do for a patient that comes in with those symptoms is that we will check their hormone levels, so that would be a blood test. And then we'll do an ultrasound as well to take a look at the ovaries themselves and see if there's anything abnormal. But most importantly is to get a really thorough history from the patient as to what they've been experiencing ever since they first started having periods.
This is really interesting. And I know then fertility. A lot of women, we worry as it is about having a baby. How does this affect our fertility?
Well, PCOS is a very complex condition, and infertility is only one of those aspects. It's also a very important one because it can give us the pulse on the severity of the condition itself. I typically tell my PCOS patients that they're actually very fertile because they have a very good ovarian reserve. Their issue with infertility is that they do not release that egg every cycle as women without PCOS do. And so that is what causes eventually the irregular cycles and also some other abnormalities inside the uterus, like endometrial polyps, for instance, that could further decrease their ability to conceive in the end.
So what can we do to help with all of this?
Absolutely. So the first thing I would say is that if you are experiencing any of these symptoms, the first thing to do is to reach out to your doctor and let them do a really thorough history. As I mentioned before, there are other things that can cause these symptoms, so we don't want to misdiagnose you. And so then your doctor can help guide you through what evaluation steps, whether that be blood work or imaging studies, would be important to figure out what is the root cause of what's going on for you.
Okay, and then can something be done like after that?
Absolutely. So there's lots of medications that can help treat some of the symptoms of PCOS and can help regulate the cycle.
Okay.
Most of those, the gold standard for treatment of polycystic ovarian syndrome is birth control pills.
Okay.
And what those do is they help regulate the cycle. Obviously, if you're planning on getting pregnant, we can't do that at the same time.
Right.
But there are other things that we can do to kind of help your overall wellness that may help get that regulation back on track.
what I love about both of you ladies is it gives you hope. It's like there's still, you can have a baby still, and there's treatment options. It's just making sure that you get diagnosed and you feel comfortable talking to your doctors. So thank you for opening up this conversation to everybody. Where can we go for more? And just to get started, I think just having this conversation is really helpful.
The American College of Obstetricians and Gynecologists has a great website that has patient information on it as well. And so if you go onto there and plug in PCOS, it'll give you information for patients. But also, you're welcome to go to Texas Children's website. We have lots of information there as well.
Well, thank you so much for your time this morning. I really appreciate both of you.
Thank you.